Namaste Mitchell. My name is Mitchell and I study nursing. The program in 3 words, it blew my expectations. Because I saw you got credits, I'm not gonna lie. And I know how jam-packed the nursing schedule can be, so it was nice to get credits. But also I knew it would be a good experience. Yes, I did get the grant. It was very handy, pretty much covered maybe 40 to 50% of what I've spent here. So it's definitely helpful. My most favourite part was probably yesterday when we went to the Combire Foundation, which is basically a safe house for people with HIV, transgender, children, anyone HIV positive. Mummy Finn is what they call her. She's just an amazing woman who has done so much change here in the community. People go there from all over Indonesia. They're on social media. It was just a crazy experience hearing about some of the stories, and one of the young man's stories there, it kind of hit you in the heart. It was very emotional. Like, his family has basically disowned him because he's gender neutral and he's HIV positive, so he's basically got no contact with them anymore. And he was very grateful just to have his handshakes, because back in his hometown, no one wanted to be near him because they're scared and uneducated about HIV. And he just showed so much gratitude, just getting a photo with him, being close to him, and not pushing away from him, which was, it was just a crazy thing to witness. When we went to the Puskesmas and Posyandu, we got to see kids and we got to give our gifts. So I gave them some chocolates and some mini koalas with a boomerang, and they were very happy to get those presents, and they were kissing them and stuff like that. So it was just good to see. I'm lucky to have traveled an Asian country before. I backpacked, so all my challenges there, I guess I kind of was able to iron out here. I was fortunate enough to not have any challenges. Acicis does an amazing job of, once you're on the tour, you just need to know when to get up. It's pretty much all planned for you. Most of the food is provided. So I personally didn't have many challenges at all. My Indonesian's not great. We spent 3 days on it, but the word Puskesmas is kind of cool. I can't remember what it stands for without the wording of it. It is, where did it go? Pusat Kesehatan Masyarakat. Yeah, it's hard. But it's an interesting word because they pretty much take 3 or 4 letters, 3 letters out of each of the words. And it's basically a community health centre, which is kind of what it correlates to, which is a GP clinic basically in Australia. It was nice to see, I guess, how lower to middle income people live and their public health system and all the problems that they have. In Australia, people are kind of privileged to say, and they complain about some basic stuff. So if there's not manual handling items on the ward, or they have to go down and find them, they kind of complain. And I understand, because it's rough for time, but here they don't have that. If you need to kind of lift someone up on a bed, you bend over and lift someone up on the bed. And the rich hospitals, I guess, have it, but I guess it just keeps you in line without not being privileged, which will take me further along. And it's just nice to see how they do their health system. I honestly couldn't recommend the trip enough. I was just here for credits, but I've had an amazing time, and it was so worth the money, and I would do it all again.